So if you look at the treatment for lupus, the scenario is changing rapidly and changing for good. In the last 2 years alone, about 4 new drugs have come into the scenario and 4 new very effective drugs. So when we talk about treatment of lupus or SLE, what we must remember is that it is always a combination of drugs that work. It's not one drug or 2 drugs, it may be 3 drugs. By drugs I mean medicines. It could be some tablets, it could be some in injection form. So we don't know who will benefit from what. It will totally be dependent on what kind of lupus you have. Do you have a kidney disease? Do you have a heart disease? Do you have a brain disease with lupus? Or is it only some skin rash that you have in lupus? So based on what you have, based on your symptoms, based on your clinical picture, a rheumatologist or a nephrologist would choose the kind of medicines that is given for lupus. Having said this, some things are common across all these clinical manifestations. One of that, which we can consider as a cornerstone of lupus treatment, is hydroxychloroquine or HCQ. This is a tablet that is given from doses ranging from 200 milligram to 400 milligram once a day, and this tablet has a lot of benefits. One of the benefits it has is that once lupus is under control, it prevents lupus from flaring again. The second benefit it has is excellent control of skin disease in lupus. And the third benefit it has is that it will prevent you from getting infections. It will also prevent you from probably developing a diabetes mellitus in lupus. So it's a fantastic drug. It's a fantastic medicine that is given in almost all patients with lupus unless somebody has an intolerance. Beside HCQ or hydroxychloroquine, there are other medications. So another important medicine that is given in lupus is steroids. Yes, we do give steroids in lupus because in lupus our initial goal or initial aim is to rapidly control the inflammation, because if I allow a kidney inflammation to keep on going, then it is going to damage the kidney irreversibly. So this is a window of about 1 month to 1.5 months that all of us have, where we have to hit it hard and stop the inflammation. So what we usually do is we give high doses of steroids if the disease is very severe and rapidly reduce it to a low dose within maybe 2 or 3 months. So what is this low dose steroid? It might be somewhere between 5 milligram of prednisone per day to 2.5 milligram prednisone per day. So this is a low dose steroid which will be maintained for longer duration in lupus patients. Because there are studies which have shown that when you remove the steroid, then there is a slightly higher chance that lupus will flare. And we know that a very low dose of steroid may be really safe in long term. So second medicine that is usually used in almost all the patients of lupus is a steroid. The third drug is an immunosuppressive agent. Yeah, this could be a simple like methotrexate, it could be a mycophenolate mofetil, it could be a cyclosporin or tacrolimus, or it could be a injection form like a rituximab or a cyclophosphamide. So these are all options when based on the severity of the condition and the stage at which you present to the doctor. So these are the usually used medications. Now coming to newer medications that are still not available completely to us in India, but they might be coming very soon, is other biological agents like obinutuzumab, anifrolumab, or CAR T-cell therapies for lupus. So all these are advances that are coming in a big way and might be available for us in India in very near future. So what I mean to say is, lupus treatment is always a combination of medications, yeah, which will be centered around hydroxychloroquine and a steroid. Along with that, there will be an immunomodulator or an immunosuppressant. So with this combination, we try to keep, first of all, reduce the inflammation very fast, and then maintain the condition for a long time, and then target cure of the condition.